what's your definition of a rich or wealthy person in Australia at the moment?
It's I don't know what the answer to that is. Because it obviously depends on, like, you could have income, but you could have a really high mortgage, and I think that puts you under a significant amount of stress. For me, our focus has been, I guess, not on everyday people, but on billionaires or close to billionaires. Like, for me, it's like once you get up to that level, that is a stratospheric level of wealth, and our approach has been to say that we can fund the things that people need to live a good life in this country, all the basics like healthcare, education, etc., without asking everyday people to pay more. And like where you then have, I think everyone could agree, who counts as wealthy. I think billionaires count as wealthy, and I think big corporations that are making excessive profits count as wealthy. And so part of what we're trying to shine a light on is to say, well, look, there's when you look at the level of house prices at the moment, you look at the level of costs, like for many people, be earning a good income but still under significant stress, and more stress than a comparable person was 3 decades ago. So for us, it's about saying, well, it's not everyday people are already being asked to pay a lot, but we've got billionaires and up, and it's those that we're focusing on.
Yeah, okay. So when you rock up to the Met Gala and you've got your Tax the Rich frock on, you're not talking about most Aussie taxpayers.
No, and we, as I say, we've been really clear about saying we're trying to shine a light on what I think often goes unstated in Australia and often goes unstated in Australian politics, which is that there's actually quite a small number of people and corporations that have got a bit of a stranglehold on the political process, and they donate to the other parties. They have their lobbyists wandering the corridors. I've seen it happen. They exert an enormous amount of power, but there's actually not that many of them comparatively. And so part of what we're trying to say is if we make those big corporations and the billionaires pay their fair share, they'll still be able to make a profit. We're just saying pay your fair share, and then that way you can deliver a lot more for everyday people without asking everyday people to pay more.
And I think the reason I wanted that kind of frame of reference is because, there are a handful, a lot maybe of everyday Australians who have got a 100K to 200 grand household income. They might have the mortgage, they might own one investment property. Like, are the Greens coming after the mum and dad trying to get ahead with just the one investment property?
No, but no, like clear. For us, it's we can have a longer discussion about the housing, tax treatment of housing, and the housing
we will,
situation
because I think we'll
in Australia.
probably agree more with same stuff than we disagree with when it comes to that. But
the answer is no. Yeah. Like, it's for us, when we've talked about changes to things like negative gearing and capital gains tax, like, we've always separated out people have got one investment property, which is a lot of people, because people might have entered into
about 70% of investors.
Right. And so because a lot of people would have entered into that on the basis that you'd get financial advice, you'd understand that these are the arrangements, might be people's retirement savings, it might be, as you say, a way of getting ahead. So for people who've got one, no, we're not talking about that. But I would think it's wrong that when someone's got 7, 8 or 9 properties, that the government is giving that person more assistance to go and buy their 10th than they are to give someone to buy their first.
Another question, and I think we'll start with the Medicare stuff. Before that, why is the Labor Party so mean to you? Is it like some frenemy thing? Because at the end of the day, like, when this thing gets hung, they're knocking on your door.
I mean, let's talk about GP for free, for example. We've been pushing that since for a number of months now, we released a costed policy about what we could do to increase the bulk billing incentive and do other things like build free local healthcare clinics. Seeing the GP for free is something we've been campaigning on for a number of months. And then in the imitations of sincerest form of flattery category, like the government came out the other day and said, oh, we also want to increase the bulk billing incentive so that most people can see the GP for free. And like for us, that was actually a really good moment. It's like, right, we are getting stuff done. I think to answer your question, like part of it is we're putting forward ideas that they know are good, and in many instances, that they've been unwilling to take the next step of actually, I guess, having the political courage to then go and implement them. So part of that, I guess we get that response, and what's the saying of first they ignore you and then they ridicule you and then they fight you and then you win. Like it's a bit like that, right? Yeah. And so you got to have a thick skin. So we're just kind of used to it. But again, I take it as a bit of a badge of honour that when we put ideas out there, first of all they attack them, and then a couple of years later they end up adopting them. Like a National Anti-Corruption Commission, we pushed that forward first. Marriage equality, we pushed that. There's a number of ideas. Dental into Medicare, we got it in for kids. Like there's a number of things like that we've pushed, and you meet initial resistance. But actually, if you keep pushing, what I've learned over time is that they might attack you at the start, but eventually, in many instances, they come around.
Yeah. On the if we go to the Medicare thing, so big push from you that you've said you want to make GP for free. Labor of promoting this now is their vibe. Uncle Pete and the fellas, they're like, yeah, we'll do it too, move on, nothing to see here. And this is where I start to trip over the practicalities of the rollout. And if I can explain my hookups on it, and maybe you can let me know part of your costings or how you see it. So at the moment, so I went to my GP, I think the week before. There's a new sign at the front door. Literally, they're printed and they're like, no bulk billing anymore. Everyone, you pay. Sure, wealthy area, all that, okay? It was for a standard appointment, $108. Medicare paid $42.85, so we'll just call it $43 or whatever. So my out-of-pocket was $65. So that GP, so most GPs in, practices, they're self-employed effectively, and they'll give 40% of what they earn to the clinic to do the phones, to do the rent, all that stuff, right? So my kind of hookup, and I'll tell you my solution as well that I can only see working, if you're a GP, your income is probably $250 to $350, and I think that's pretty well accepted that obviously some would earn a lot more, some might earn a lot less, but we'll call it $250 to $350. And that's based on potentially 22 patients a day, $100. And, it can all vary, but go with me, everyone. If I'm a GP and I don't have to do bulk billing because, free world and all that. So that means out of my own compassion to help people, I would say we're a bulk billing practice or something like that. It would literally mean, as this professional goes about their work, if they were doing only bulk billed stuff, like their income could be 40% less. And I just don't think that works because they study a hell of a lot. For those who aren't in doctor land and all that, GP is a specialty, like an orthopedic surgeon, like it's a specialty. Yeah. Why would you want to study for so long to get to the end and go, oh, do I charge $100 an hour or do I charge $42 and the clinic still takes a clip? So the only way I can see it actually happening, and I talked to a GP before this morning and he agreed with me, the only way I can see it happening is the federal government literally owns and runs the clinics and the doctors are employed at comparable market rates, and that's the GP clinic.
So there were three elements of our.
Does that make sense? Just from
it makes 100%
guy
sense.
on the street.
Makes total sense. There are three elements of our proposal, and the government's picked up one, and which we're very happy about. And I think if you did all three, it'd deal with the questions that you've raised. The first is that we've been pushing for is you triple what's called the bulk billing incentive. So as well as getting the Medicare rebate coming through, doctors get a payment at the moment if they just bulk bill, and that payment hasn't been increased. And a little while ago, the government made a move which we applauded, which was they tripled the bulk billing incentive if you had a healthcare card, but they didn't triple it for everyone. So a key sort of element of our announcement, which is what the government's picked up, is tripling the bulk billing incentive for all appointments. So you give those, so to cover that gap that you just spoke about, you start to give them an incentive.
But would that incentive creep up to getting that $100 of standard visit?
Well, the second thing that the government hasn't picked up on that we pushed based on advice from the doctors, because they said this was one of the elements, is increasing the amount of the rebate for longer consultations, because one of the things that doctors have said to us is a lot of the problems are actually more complex and they require longer time, but they're just not getting remunerated enough for that. The message that we got back from certainly the RACGP and others when we announced our policy that had those two components together in it is that they said that would go a long way. And we had some other things as well, like about supporting doctors being trained, because as you say, it's a specialty, and for a lot of people training to be a GP, they could get a better rate going off into somewhere else, into hospitals or some other area. And so there's some other things that we can do at the back end as well, the workforce end. But those, certainly the advice that we got from the doctors' groups as we were formulating our policy was that those two things would make a big difference. The third thing that we proposed that unfortunately the government hasn't picked up yet, but we live in hope, is to do a version of what you just said, which is to have is to build 6 free local healthcare clinics in every electorate around the country where you've got people who are salaried. And so you'd have a salaried doctor, you'd have a salaried dentist, a salaried nurse, and other sort of allied health professionals running in health clinics where you'd come in. So you'd expand them over time as money allowed. And that way you've got the option of you increase the number of private practices that are going to, because they get these extra payments that will bulk bill, but you'd have that public option as well.
Yeah, because, when they did the GP super clinic, it was, I don't know the details of it, but it was still more a private clinic, and maybe they got funding to build it or whatnot. But, you'd go there and it'd be a bloody debacle anyway.
Just have some salaried professionals,
and
like we do in hospitals. Have them in the free GP clinics, free local healthcare clinics, and people can walk in off the street.
Yeah, because it really and this is the problem where a lot of the policies that I like in principle, you take it, if it's half cooked, it just doesn't work because there's no incentive for the actual free market to want to do that.
Yeah, well, as I say, we like to take expert advice when we come up with our policies. We took advice from those groups, and we also looked around the world at sort of what is good practice, and there are other places that run the free local healthcare clinics, and something that we wanted to do here as well. I would say too, though, that this comes back to that broader question when you asked me at the start, like what would be the one thing that I would fix. We've got a situation at the moment where the pressures on public healthcare, public schools, like we've just did some number crunching last week, and parents and carers are now paying over $1 billion a year in those so-called voluntary fees to send children to public schools, right? This is public schools that are meant to be already funded and paid for. There's been this slow...
It could be up to $1,500 a year per child or something.
Right. And then on top of, on as well as some of those voluntary fees, you've also got the uniforms, you've got camp, you've got et cetera. In health, in education, all of the systems are getting squeezed more and more. financially by governments, and what's happening is the pressure is being pushed down to everyday people, and so you find you're paying more to go and see the doctor. You find you're paying more to send your child to a public school, and a big part of that. And when you say to the government, "Well, look, hang on, we can fix these things instead of having these systems under stress," they say, "Well, there's not enough money in the kitty." Right, and this goes back to that point that I was saying at the start, that for so long as there is this, I guess, systemic non-payment of tax by big corporations and like billionaires, we spoke about billionaires before, in the last, while everyone else has been doing it tough, like in the 6 years leading up to 2024, Australia's billionaires doubled their wealth, right? You know, did you double your wealth? How many people doubled their wealth in the last 6 years while we were living through COVID and so on? Australian billionaires doubled their wealth, and part of the role of government really ought to be to say, well, we've got to make the system work for everyday people so that everyday people can afford all of the basics. And if that means we've got to take on those billionaires and the big corporations and say, look, you've got to pay a bit of extra cream off the top. It allows us to do all these things that you spoke about, and there might be implementation or teething problems as we roll it out. But we know Medicare, broadly as a system, works. And you look at the US and you think, well, we don't want to go down that road.
And this is where I kind of always struggle. It's like you look at US, extreme capitalism, pew, freedom, democracy, horrendous. But you look at the other side, the most socialist/communist country in the world, probably not going to like to live there myself. So how do we have some type of balance? Because I just think it is so cooked that just because one lady took over her father's mine, that's printing money off the back of all the freaking rocks in this island.
Look, I just think there's a few... I don't quite know what the analogy is. It's like someone needs to go into settings and make a couple of adjustments to the fundamental ways in which parts of our economy and our tax system and our government are run. Because for me, to answer your question about what kind of country do we want to live in, for me, it's about saying we're a wealthy country and a prosperous country, and we want to continue to be so. But in a wealthy country like ours, everyone should be able to afford the basics, and it shouldn't be that hard. You shouldn't be under so much pressure to get a house. It shouldn't be under that much pressure, and it wasn't like that 3 decades ago. And so, we need to just make those changes to the system that mean it starts working for everyday people again. Do that, and I think we're going to continue to have successful businesses in this country. That's going to continue. It's just going to be that everyone else isn't going to have to do it quite so tough.